to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. My name is Dr. Elena Borrelli, and I am from Pathway Patient Advocates. Pathway Patient Advocates is a private patient advocacy company that serves all 50 states as well as Canada. So in many states, private patient advocacy is a new concept, and many people really aren't aware of what a private patient advocate is and what we do. And so today we'll be discussing how a patient advocate can help someone specifically dealing with cancer. So we do help patients with a variety of different disorders. I have one area where I specifically have a large bulk of my clients, which is undiagnosed or rare disorders, including cancer. However, we do help in a pretty wide variety of symptoms, even with clients that don't have those disorders. But today we're going to specifically focus on patients that are dealing with cancer. So cancer is unexpected bad news that no one wants to hear. Oftentimes, a treatment plan is started immediately due to the potential of the quick disease progression. So what happens when cancer treatment's not working as expected? It's definitely an emotional roller coaster, and dealing with the side effects of treatment, waiting to see if any improvements is noticed on imaging or other tests, and why not so, when you're not getting answers or when not so good news happens, you're often being left feeling defeated. And it doesn't just negatively affect the patient, but also families and loved ones. But I want to share with you some hope. It doesn't have to stay that way, and it doesn't have to be that way. So your journey through cancer can really be improved with the support of a private patient advocate. And there's so many different factors and areas that can be heightened. And we'll talk about that in detail. And so whether you're going through these health issues or cancer yourself, or just seeking valuable information, you're definitely in the right place. So we've been receiving a lot of messages and letters asking about this specific topic. And so we're really eager to go over a few. So I just pulled a couple that I want to share. So first letter is from Norma. And Norma said, hi, my name is Norma from New York. My mom has been battling with breast cancer for the past year. The moment we learned about her condition, we immediately looked for an oncologist who would treat her. The first few visits were good. He was able to meet us and assure us of all of the treatment plans. But as time went by, almost all of her appointments were rushed, and we're not happy with the answers to her questions. Now we felt neglected, and we're thinking about looking for a new oncologist for my mom who specializes specifically in breast cancer. Should we change oncologists, and how can you help with this? I'm so sorry to hear that, Norma, and I really sympathize for you. I know this is a very difficult process. If you feel that you're not getting enough answers, or your trusting relationship with your oncologist is fading, you may be wondering, is it too late to change oncologists? And the answer is absolutely not. It's never too late to change to a different provider. If the second opinion is something that you're considering, then I say go for it. If the second opinion gives you the same opinion as you currently have, then it can offer a piece of assurance that the previous recommended plan is a good one to potentially follow. In contrast, the second opinion may offer a completely new treatment plan and one that hasn't been considered before. Every person is different. Every provider may offer a new outlook on something or a new treatment option that hasn't been considered. Sometimes, not always, but sometimes the two specialists may be willing to work together, which is even better. As the old saying goes, two heads are better than one. So finding the most qualified provider to meet for a second opinion requires a lot of research, preparation, devotion, time, energy. And it definitely takes a toll, especially when you or a loved one are dealing with a medical condition such as cancer. That's one area where a private patient advocate can help. At Pathway Patient Advocates, we find the second opinion or the third opinion that you may need. And it's just not another random provider. It's really somebody that we feel will best manage, diagnose, and treat your symptoms. We put a lot of personalized time into finding that person that's just the best fit for you. We will attend appointments as needed and help you navigate that journey with you or your loved one. We also offer a non-biased opinion, and we're not affiliated with any health insurance company or healthcare system. Our only focus is helping you, and that's one of the strongest features of a private patient advocate. Our next letter is from Lorna. So Lorna is from Nebraska, and Lorna says, my daughter was diagnosed with hyperthyroidism, and she's 16. I also have another child who's 10 years old. There was a time that I can't join her at her doctor's appointment because of my work and my other kid. Sometimes it's really hard and overwhelming for me, but I would always think the best for my children. How can a private patient advocate help with childhood cancer? I'm so sorry to hear about the challenges that you've been facing with your family, Nora, whether it's a chronic condition like hyperthyroidism or cancer. A patient advocate can help you find the best care and resources for your child, in addition to saving hours of time, which instead of you spending those times navigating through the chaos of healthcare, you can spend those times side by side with your children and loved ones. We can help clarify things that don't seem to make sense, as well as help review medical records and obtain necessary appointments in a timely fashion. Those are just a couple of things that myself as a private patient advocate can do. Also, I can review medical bills and try to eliminate those unnecessary charges as much as possible. What's also frustrating is perhaps you find some type of treatment or procedure that you think is really going to be a strong next step in diagnosing or managing your care, only to find out that it's not covered by your insurance. Or maybe if you don't have insurance. Those are things that we can help navigate for you. Lastly, we can provide you with additional resources to help you and your child have the best possible care, quality of life, and experience during this difficult time. We are very networked and have a lot of different resources that we've used in the past that we're familiar with. And if we're not familiar with something, we're continuously growing our resources and researching it to get and learn and stay on top of new options available and resources and treatments. Reading a question from Jolie 211. Do you have a fee for taking on a family with childhood cancer? So we do have we'd like to start with a consultation. There is a fee for the consultation. However, we do offer a 15-minute consultation that is complimentary. If you want to just kind of talk to me and learn about, how we can help and get a little bit more information before you want to take that next step in deciding if you want to book that consultation, you're welcome to do that. And there's no fee for that. You can always send us an email after or give us a call. Our office number is 947-517-8395. So our third question is from Grace. My son Ryan has been having pain for so long, and we've been going in and out of the hospital. His doctor confronted us about his condition and asked us if we had relatives that have cancer. My husband and I talked about the possibility and our next steps. That's when we decided to take genetic testing. Is it right for us to do this? It's a great question, and I'm very sorry to hear about the challenges that your son has been facing. I can only imagine how difficult this must be for both of you. I have a son myself, so I can definitely relate to the struggle of being a parent and wanting to help your child, but not knowing how to sometimes. It's heartbreaking to witness your child or a loved one going through such a stressful situation and distressing symptoms. So precision testing is an emerging field of medicine that relies on genetic testing to tailor treatments of each patient's unique physiology. In other words, it's a type of customized medicine. Genetics can be used in a variety of things to help determine your genetic likelihood of having a disorder, to help determine the best treatment. So there's a variety of different ways that genetic may fit your condition. It's very specialized depending on to what condition you're having and what symptoms you're having and thus forth. So that topic is a very great topic to explore, and one that really requires further discussion and details as to what specifically you're looking at, what's the best type of testing for you. There's such a vast variety of options when we talk about genetic testing, but it is a great scientific advancement that has really, really helped many. So if you or a loved one have a rare disorder, including rare cancers, you may be considering genetic testing and precision medicine as a treatment option. Before making any decisions, it's really important to understand that genetic testing can carry some risks, including the possibility of misinterpretation or misdiagnosis. Do we have physicians on staff to review medical records? Yes, we do. The best component of a private patient advocate, and what really gives me job satisfaction, is that we really have a one-on-one personalized approach to every single person that we work with. And it really helps us build a trusting relationship and help find what we need to find and move forward so that we are getting the proper answers that we need, the proper quality of life that we are striving for, and the reassurance that we're doing the proper research and that we are exhausting options to make sure that we continue to work toward the goals and on the right path so that we can achieve those goals. Our time has come, and it was really great chatting with everyone. I look forward to continuing further discussions on one-on-one with each of you, but feel free again to reach out to me. I'd be happy and look forward to speaking to each and every one of you. Have a great evening. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.